And I hope we can have 5 minutes break after this session, so you will have that to look forward to as well. But you can also look forward to the next presentation. That's about methodological issues when interviewing disabled care leavers. Lessons learned from South Africa, Norway and Northern Ireland. So that will be Wendy, Ingri and Berni, and you can also present yourself. I'm not sure who's starting.
I'm starting. Just give me a moment to start my video.
Yeah.
Great. You can hear me and see the presentation, Ingrid?
Yes, fine.
Fantastic. We really are moving across the world in Global INTRAC this afternoon. So we started in Australia, and now I'm from Belfast. I'm presenting today with Wendy and Ingri, and I'm presenting from Queen's University, Belfast today. Wendy, Ingri and myself are working on a chapter for the same book, Living on the Edge, and our focus is on methodological issues for interviewing disabled care leavers. I'm going to begin by giving you a bit of context about the background to the chapter and why all three of us are interested in presenting on it today. And then Ingri will present on one of the core themes around identity, and then Wendy will discuss some of the challenges in relation to communication. And we hope we'll have some time at the end for a couple of questions or discussion. So in terms of the background, we have a number of studies now in different parts of the world that indicate that disabled youth are overrepresented in the care system and in the population of young people leaving care. It ranges from about 11% to about 50%, depending on the country and the context where the research is undertaken, but persistently shows that we have more disabled young people leaving care than we have in comparison to the general population. These young people have different types of experiences of disability or impairment, and they have multiple transitions. They sometimes leave school at a different age, they move out of care, different types of care, and they also transition from child welfare services into adult disability or mental health services. And while we have a strong body of global research around care leaving, as we can hear today and in other conferences from INTRAC, much less attention has been given to the experience of disabled youth. So as this is only an emerging field of study, we don't know a lot about how to design studies to recruit and to involve disabled young people in care leaver research, or how to negotiate those complexities of interviewing disabled care leavers, which was the experience of the three of us. So this presentation aims to draw on the experiences across our three studies. They were conducted here in Northern Ireland, but also in Norway with Ingri's study and in South Africa with Wendy's study. And today we want to begin to explore the challenges that we have commonly encountered across those three studies, to offer some guidance to others who might be thinking about developing care leaving research that is more inclusive of disabled young people. When we first got together, the three of us, to talk about our common experiences, we discovered that there were two key themes emerging from all the studies, and they could be grouped as you can see here. Firstly, in terms of actually sampling and recruiting disabled care leavers, and secondly, in terms of trying to develop an inclusive research approach. We don't have time to go into each of the sub-themes that we're hoping to explore in our chapter today, but you can see them there on the slide. But I'm going to hand over shortly to Ingri, who will explore that last one under the first theme, which is around identities, the effect of multiple identities, the imposition of labels, and the complexities of self-identification. And then Wendy will begin to explore the inclusive research approach. We need to do some work in advance of interviews, work with carers and birth parents, and adapt our tools. But we also have to be very responsive during field work and address individual communication needs to integrate different ways for young people to take part. So Wendy will be exploring that. So I'm going to hand over now to Ingri.
Thank you. Yeah, just like Jade, I think the three of us have experienced that it has been quite difficult to engage disabled care leavers in our research. And what we experienced was that care leavers often did not identify with terms related to disability, even if they described disabling experiences in the interviews. And we have struggled to understand this. What could this be about? And I think there are several reasons, but some might be these. First, I think that the young people, just like all of us, had multiple and sometimes competing identities. For example, it can be a very heavy burden to both carry the identity as a careleaver and as a disabled youth. In other examples, it can be impossible to both be a promising capacity in an educational field and at the same time be seen as disabled. This leads to the next issue, namely disability as stigma. The term disability can signal otherness or exclusion, while youth in the transition to adulthood often aim towards belonging. And I also think that care living is a process where you want to transit into society, while disability traditionally has been seen as a process of transiting out of society. It's not long ago since disabled people were living in special care facilities or in special houses away from the others. I also think that many of the youths had a very narrow script for disability, just like society in general and child welfare services, that being disabled might have been seen as some kind of medical condition. And then the next slide, Berni. We think that this is important because if there is a gap between the research categories and people's own identity, we think that both research validity and research reliability is at risk. And furthermore, if we force research categories upon people, we are also breaking important ethical principles for research. So we have tried to discuss how we can move this issue forward, and we think that it is important to create research categories that are in line with people's own identity. This implies that we have to put the issue on the agenda. What words do young people themselves use? And we also think that it is important to develop theoretical foundations for this research that opens up to the interpretive work the young people do when trying to relate to their disabilities. And we also think it is important to build an awareness about emic and ethic terminology, that we have to recognize that the words that we are using as researchers and in theory are different than the words that are used by the youth and by child welfare workers. Wendy, you're next.
Thank you very much, Ingri. Good afternoon, good day, good evening, everybody. My name is Wendy. I'm also part of the co-authoring of the chapter on methodology with Berni and Ingri. So to respond to the individual communication needs, some of the lessons that we've learned from our 3-country study was that it's very important to adapt the research tools and ensure that one considers the cognitive and communication needs of the participants that are included in the research. And what we think is also very crucial is to create a communication toolbox. And we have just a wide range of items that could go into the toolbox, such as if you've got speaking participants, it's also very important as a researcher to speak clearly so that whatever you're trying to convey or ask is clear. Have picture exchange communication schedule, and I'll speak a little bit about the preparation and how you can get to know about what kind of communication system the young person uses. Board maker, makeathon, sign language, often this would be for non-verbal participants. Assistive devices, in some cases we're also quite instrumental. And then pictorial images for key interview themes. This is also very helpful, and to just remember to make sure that your questions are as concrete as possible so that the disabled participants can access them and understand exactly what you're trying to ask and the information you're trying to collect. Flashcards, or visual images. In our studies, we used emotions cards, which was also very helpful for them to see the different ranges of emotions. And then we also had activities like life maps, which helped us to see the life journey of the young person who was in transition to adulthood from care. And the eco map also gave us an idea of the support systems or lack thereof. And it was a fun activity also in some instances with the disabled youth to engage with them on that, and interpreter services as well. Next slide. So we come to the reason why is this important. We feel that in line with the social model of disability, it is perhaps time for us to shift towards inclusive research, whereby we focus on disabled peoples and addressing the barriers that may exclude them from participating in research. And that's making sure that the research tools are inclusive and that the methods are carefully looked at. So how does one carefully look at those research tools? So some of the things to do when you're preparing and adapting the interview tools is to meet with the young people. But why is this important? It's important because it enhances the quality of the interview, and it also allows for you to have them, sorry, Berni, it gives the young person an opportunity to express their views in their own voice. And it also helps to mitigate around the danger of disabled research practice. So we had quite a big conversation about this particular element, because we went back and forth about some of the experiences we have encountered in your endeavor to try and ensure that the research tools are accessible. You might actually then be disabling in a way. So it's quite, we found it quite a challenge, but we also wanted to share our experiences with regards to that. So some of the things to take into consideration in order to prepare adequately is to meet the participants before the actual interviews, so that you introduce your study, as well as to establish a relationship with the young person. It's also very helpful because you get to meet the key people or the interpreter who might be familiar with the young person, or with whom the young person speaks to or uses as an interpreter for communication. And then it's very crucial to identify their communication style and then create a communication toolbox. So this is something that you can't go in once and just have it. You can just continuously revise it, and even in the field, just to ensure that it becomes much more sharpened and useful for data collection and for the participation of the young person. And then use communication aids where it's necessary. One of the things that we also felt, especially with our participants, we worked primarily with a lot of people with disabilities, neurodevelopmental. So things like sensory regulation and sensory integration was something that we experienced. So considering time and the place where you conduct the interview, we found that quite important, because in some instances, the young person might have a lot of sensory difficulties, be it sound or lighting. And if you're not aware of these things, and then you find a venue that is not accessible to them, then it actually stimulates them and you're not able to continue with the interview. But it could have been alleviated by ensuring that the room is conducive to conduct the interview. And the time, I think one of the things I like to emphasize is just being able to be flexible as a researcher, because taking into consideration a person as a whole and how in some instances they might struggle with some emotions, or where they're at on that particular day you come for the interview, just to be able to wait around a little bit if they're experiencing some sensory difficulties, or just to give them the breaks that they may require. In some instances, they were short breaks, but in some instances, they wanted much longer breaks, and to have that flexibility to do that when you're in the field gathering data. And then adapting the interview guide. And it's important to offer different versions. This is crucial because if you look at the wide range that you need to consider, such as literacy, comprehension, and concentration, it's always important to take those into consideration, because they inform the kind of tools that you use and the kind of breaks that you have in between. And then the last bit is just conducting research over multiple interviews. So in our cases, we had longitudinal studies, so it actually worked to our favor, because we were able to fine-tune the interviews as we continued with the different waves. But in some instances, you're not always able to do that. But even if you have to go in the second time just so that you can get rich data, it's something that we would highly recommend, so that you can allow the young person to fully participate and not be rushed because of time constraints. I think that's all from my side.
Sorry, I just realized I'm on mute. Our last slide, I'm just going to summarize our 3 points to put this together for us. Our first point really is that, as Ingri has said, the complexity of identities needs really careful consideration to ensure a valid and ethical approach to recruitment. So the researcher has to be open and flexible and aware of those complexities as they seek to recruit and retain participants. As Wendy was saying, research tools must be adapted in advance, but they also have to be refined as we get to know the participant and their individual communication needs and their preferences. And I suppose that on a general note, the 3 of us have commonly talked about the issue of how qualitative research with disabled care leavers can be challenging. We've certainly, all 3 of us have encountered those challenges, but there are a range of strategies that we can use to address those challenges and to work towards more inclusive research. And by doing that, we think we will raise the awareness of the prevalence of disability within the heterogeneous population of care leavers. We'll also capture the voices of a greater range of young people, including those who have more diverse or complex or marginalised experiences of transition. So our view of transition and our theorising of transition can be expanded. And finally, we think that doing some of the research and using some of the communication methods that Wendy has mentioned makes us better researchers. We become better participatory and ethical research with all young people. So there are benefits for us as academics engaging in the field of care leaver research more generally as well. That's us. Thank you.
Thank you.
Thank you.
Any questions? Let us know.
Yes, we have time for some comments, questions. I don't see everybody, so you can use the reaction button and raise hands, or in the chat, or later on. I think we'll then move on to the next or the